So do you recognise these dots? Well, if we put in the head and the spine, you'll see that they are the shoulders, the hips, the knees and ankles. And they're designed to be so that the shoulders are level with one another, as are the hips and the knees and the ankles. That's horizontally. Vertically, the shoulders, hips, knees and ankles should all be stacked up one on top of the other. Now if we were to draw straight lines through those horizontal load bearing joints and down through the verticals, what we would get are a series of right angles or a grid emerging. And right angles are the key to understanding your body's design because they give it strength and durability. And we call this the right angle rule of function. When your body maintains what we call the right angle rule of function, then everything's happening as it should be. Your body functions as it was designed to function. It's when we deviate from the right angle rule of function that problems start to occur, and eventually we get wear and tear, and it manifests eventually as pain. So in the side view it's exactly the same. The shoulders, hips, knees and ankles are stacked up on top of each other. You'll also see here that rather than the head being forward as it so often is, it's back in its mutual functional position with the ear directly aligned over the load bearing joints. And if we put the spine in, what we can see here is that in its natural state the spine is designed to be an elongated S. So it has a curve in the lower back, the lumbar spine, then an outward curve in the middle back, the thoracic spine, and then another inward curve for the neck, the cervical spine. And now the spine sits on top of the pelvis, and the pelvis in terms of posture is the heart of it all. Its importance in the body is so great that it's been nicknamed the second brain. Misalignment here is definitely going to have an effect above in the upper half of the body and below in the lower half of the body. So here we can see a neutral pelvis where both sides are level with one another from left to right. So both sides are functioning equally as they were designed to function. And in the side view, here we can see that the pelvis is also neutral, so it's not tilting forwards and it's not tilting backwards, it's in a neutral position. And you can just see the lower part of the lumbar spine there, and it sits on top of the pelvis. So as the pelvis changes its tilt, because the rest of the body has to respond, and the spine, because the spine sits on top of the pelvis, what we often see is the spine losing its elongated S shape and becoming more like a C shape or an inverted J, or sometimes it's flat like an I. Now here we've got a couple of examples of what can happen when posture starts to become compromised. So elevation is a very common deviation, and here we've got elevation of the right shoulder or depression of the left shoulder, and an elevated left hip, or the left side of the pelvis is elevated. And then from the side view, what we were just talking about a moment ago is where the pelvis can tilt. So here we've got what we call an anterior tilt, which is where the pelvis tilts excessively downwards, forwards and down. And the opposite of that is a posterior tilt, where it tilts backwards. Now it's not shown in these diagrams, but what will happen as the pelvis changes its tilt is the upper back 9 times out of 10 will round excessively forward, bringing the shoulders with it, and of course the head will come forward of the plumb line. So remember that the spine is designed to be an elongated S, but when the pelvis is in a posterior tilt or an anterior tilt, then the spine has to respond to that, and it loses its natural curve and becomes a C shape or an inverted J or even an I shape. And there is the pelvis and the spine together. So another common deviation in posture is what we call knock knees or valgus stress. That's where the knee comes inward of the line of the hip and the ankle. So rather than being stacked up one on top of the other, the knee is now closer to the middle of the body than the hips and the ankles. And the opposite of that is what we call bow-legged or varus stress. That's where now the knees are outside the line of the hip and the ankle, so still not stacked up one on top of the other. So if we put some flesh onto the load bearing joints, we get an idea of how we should look from the front and the side view. Now here we can see that the hands are away from the side of the body. There's a gap between the arms and the body there, equally from left to right, and all we can see on the hands is just the thumb and the side of the index finger. So we can't see any of the backs of the hands at all, just the thumb and the index finger, and that's because the spine is in its natural state, which is an elongated S, and the shoulders are rolled back evenly, bringing the arms with it. Here we can also see that the knees are facing forward, which is how they're designed to face. Now the knee is a hinge joint. It's designed to go backwards and forwards, but it's not designed to rotate from side to side. So the knees face forwards, not turning out and not turning in. We call the knees the window to the pelvis because they tell us an awful lot about what's going on in the pelvis. So quite often knees will turn out or they'll turn in, and sometimes you'll get one knee that turns out and one knee that turns in. We know then that there is definitely a hip disparity in that the left and the right side of the pelvis aren't doing the same thing. The feet also, like the knees, are designed to face straight ahead. So not turning out to the sides, not turning inwards, but straight ahead. The way that you're designed to walk when you're walking along is that your heel should strike the ground, then you roll onto the balls of the feet and then push off with the toes. If the feet are turning out, for example, then what happens is more like a waddling duck, in that it will roll onto the inside edge of the foot. So the key to remember with what we're looking at here is that the body is a unit. It says at the top of the slide that your body works as a unit. That is fundamentally important, because if there's a problem in one of your load bearing joints, either any of the shoulders or the hips, the knees or the ankles, if there's a problem in one of those, then it's a given that the other 7 load bearing joints are having to do extra work and take up the slack for that one problem, which is what we call compensation, which eventually leads to wear and tear and pain, which none of us particularly like. So the body is a unit. Now let's say, for example, you've got a problem with your left knee. Conventional treatment would have a look at the left knee and work directly on it, and possibly a little bit above it and a little bit below it. But that's the site of the pain, and it's very rare that the site of the pain is also the site of the problem. Okay, the pain is just a symptom, but the problem, the reason that the pain is there, is coming from elsewhere. So in this example we've got left knee pain. Let's say though that the right hip isn't functioning as it's designed to function. Something isn't working properly. So because the right hip can't function as it's designed to, it deviates to get out of doing its work. So in this example here we've got it elevated. It could also be rotated forward. So now it's elevated, which is putting more load onto the left side. So as you walk around on a day-to-day basis, taking what is the average of 10,000 steps every day, eventually the left side of your body is going to say, I can't do this anymore, and it will tell you by letting you know with pain. So the left knee is where the pain is, but the problem is in the right hip. Now until that hip disparity is addressed and that right hip is reminded of how to function the same as the left hip, then the problem hasn't been addressed. And here we can see an added complication in that, as well as the right hip being elevated, we've also got valgus stress on the left knee. So back to the body as a unit. That is the key to remember with what's happening with your body. If you've got pain anywhere in your body, the site of the pain is very rarely the site of the problem. Your body works as a unit, and until it's addressed as a unit, the cause of the problem hasn't been dealt with. So when you come along for your appointment, what we'll do is we'll look at your body and we'll compare it to the blueprint design, and we'll look to see how it deviates, and then from there we'll look to get it functioning more as it was designed to.